Hello, I'm Dr. Dhanya Dharmapalan. I'm a consultant in pediatric infectious diseases at Apollo Hospitals, Navi, Mumbai. Dear parents, we are all aware that our country has started vaccinating our adolescent age group from 15 years to 18 years from January 3rd onwards. Let me therefore provide you some very important information related to pediatric COVID vaccination. The first question that comes to everybody's mind is that is the vaccine safe for my child? Yes, because every vaccine that is introduced in a pediatric population undergoes a rigorous assessment of the safety data by the regulatory authorities. The second question is that why should my child get a vaccine? Because COVID is usually mild in children. Correct. Though COVID is a mild illness, there are various reasons why the child should benefit from the vaccine, especially when you have a safe vaccine. First, it gives individual protection to the child, that is, the child doesn't suffer from the disease. The second reason is that there are children who have higher risk compared to other children for hospitalization and complications. Especially, we have seen that the adolescent group has the higher risk for hospitalization and therefore they have been prioritized for vaccination. Secondly, even children who have comorbidities such as heart disease, chronic neurological disorders, cancer patients, so etc. All these children who have chronic health conditions can have a severe course of illness. So these children also require protection. Thirdly, what happens is when a child is vaccinated, there is less chance of community transmission because if you see, India has the largest child population in the world. About 35 to 40% of our population are children. And thereby, if you leave this population unvaccinated, it will be difficult to achieve reduced community transmission of the infection. Even if they have found that virus load can be equal in vaccinated and non-vaccinated population, vaccinated people get rid of the virus very rapidly as compared to unvaccinated. So thereby, when you have a huge population of vaccinated people, there is less chance of community transmission. So vaccinating your child also helps the community. And lastly, the COVID pandemic has had a very bad psychological impact on children. They have been worst affected with the school closures, social isolation from their peer groups. So, with vaccination, the parents can be more confident of sending them for contact sports and school activities, though they are not essential for sending them to school. Now, the third question is what precautions can one take for vaccination? First of all, if your child is suffering from an acute febrile illness, it is better to defer the vaccination to some other date, that is after full recovery of the child. Secondly, you must remember that despite vaccination, there are chances that your child can get infected. So, vaccination is not the only tool, but it is just one of the tools to prevent the disease. Therefore, COVID appropriate behavior must continue even after vaccination. That is, wearing mask, hand hygiene, and social distancing. And lastly, the question is what are the side effects which are expected from the vaccine? Generally, the vaccines approved, they have mild side effects such as fever, pain at the injection site, or body ache, general tiredness, fatigue. And these symptoms usually resolve in 1 to 2 days. For fever, it is best to take paracetamol and can be easily managed at home. But still, in the coming weeks after vaccination, if there is any health issue, it is important to contact a medical professional nearby and seek medical attention. Thank you very much. So let us protect each other in this fight against COVID. Thank you.